stem cells.
Now, stem cells are a leading edge of research right now because it's now thought that the stem cells, which are what we call pluripotent cells, they can turn into anything. They are floating around in the bloodstream of cancer patients, and chemo and radiation do not work on them, so it doesn't even touch them.
The trouble with chemotherapy and conventional treatments is they have no effect on the cancer stem cell. They only kill the daughter cells, the cells that are produced by it. So the tumor will shrink and they'll claim success, but you haven't killed the stem cell, so it all just comes right back. And what they found is when it comes back infinitely more aggressive than it did before.
Again, chemotherapy is a chemical agent whose sole purpose is to kill cells. And the thinking, the medical justification is, well, we're only going to kill the cancer cells. Well, even that doesn't work. If you shrink some of the cells of a tumor, you still have the cancer tumor stem cells that just regrow that same tumor. And then at the same time, you've poisoned healthy cells in the body. So you've now reduced the ability of the body to fight future cancers and future insults and challenges to the immune system.
One of the problems with chemo is because when you patient do chemo, those circulating tumor cell, cancer cell that we have, once you have the primary tumor, they can mutate and they become more resistant to other treatments. Circulating tumor cells is formed from the primary tumor and also circulating stem tumor cells. And those can become bad cells, cancer cell, or may not. But circulating tumor cell as well, both of them will float in your body. That's why when you do surgery or chemo or radiation attacking one area, you're not getting rid of the cancer. What happens? You have these circulating tumor cells floating in your body. Circulating tumor cells keep adding up, and then what do? They go and metastasize, even regional, that area, recurrence, or they could go do distant metastasis. That's why it happens. That's why patients like, oh, I removed both breasts, I remove all this, why is it somewhere else? It's because of the CTC.
The thing about it is because of the way that the cancer practice and industry really looks at the 5-year survival rate, is that they may, quote, treat somebody, give them chemo, radiation, see the tumor regress, go into remission, and then 5 years and 2 months later, when they get another cancer, they can just define it as a new cancer and not look at the root of it, which is that it was just those remaining, the subpopulation of cancer stem cells that were not only resistant to chemo and radiation, but were enriched, that then grew back slowly over time, because as you know, right, a tumor or a cancer could take decades before you actually can get it to be surveilled. The problem, of course, is that it's about the microenvironment of the, quote, cancer cell. We have to adjust and change things back, detoxify, we need to supplement with the right nutrition and information from the right foods, hydrate, oxygenate. Those are all the factors that will then re-educate that cell to say, oh, wait a second, I'm supposed to do this particular job as a hair cell, this job as a heart cell. I'm not going to go become a cancer and try to take over the whole body.
So he took some blood and he sent it to Research Genetic Cancer Center over in Greece to do what was called a CTC count, which is a circulating tumor cell count, which is what I now know why all those women had breast cancer when their breasts were cut off in the trash can. That tissue was gone. They would have breast cancer come back in their liver, in their lungs, or in their bones, because any tumor over 2 millimeters has blood perfusion, and those cells were circulating and they took up shop in another place. I didn't know that, and I was a registered nurse. I was trained.
But the surgery did nothing for the circulating tumor cells?
All it did was make sure those women did not get cancer in the tissue that was thrown in the trash can.